Red flags you need to know about if your child has a respiratory infection. I am a physician and respiratory infections are definitely on the rise. Good news is that the vast majority of respiratory infections are viral in origin. They get worse over 2 to 3 days and then start getting better. In most of these cases, there is no need to see a physician, have a prescription. You can deal with this with home remedies as well as fever reducing medication that you can get from the pharmacy. However, it is important to know red flags. And this is a list I've compiled myself. I'm not using any textbook references here. I categorize red flags into 3 categories: timing red flags, appearance red flags, and symptom red flags. Most self-limiting viral infections will peak at about 2 to 3 days, and after that, you will see a gradual return to normal. Some symptoms, like a dry cough, can linger for a few weeks even, but you should feel better subsequent days compared to previous days. And as long as that is happening, there is generally no need to do anything. It should get better by itself. If you're not seeing that kind of pattern, then it may well be wise to see a physician. Next red flag is an appearance red flag. Children do look unwell when they have a fever, but they should improve once you give them some Tylenol and Advil, and they should be able to get back to their normal self, perhaps a bit tired, but playing as normal, sleeping as normal, eating as normal. If that does not happen, if they appear listless, irritable, or particularly if you have a new onset rash or any appearance of breathing difficulty, breathing hard, or breathing fast, then you need immediate medical attention. Third red flag I would describe would be symptom red flag. Now, with an upper respiratory infection, you can expect some degree of congestion, blocked nose, sneezing, sinus pressure, ear pressure, throat pain, dry cough. These are expected symptoms. In some cases, however, a bacterial infection can take over after the first 3 to 5 days, and you can get more localized and more severe symptoms, more severe ear pain, perhaps a discharge, more severe throat pain to the extent that it's difficult to swallow. You may even see the white spots on the tonsils that are associated with strep throat, chest pain when you take a deep breath in, or visible swelling and tenderness when pressing on a sinus. These can be signs of a secondary, more localized bacterial infection, and could be a pointer that you need to consult with a physician and may require antibiotics. Please remember to do an at-home COVID test in any patient with respiratory symptoms.